Hello, dear viewers, and welcome to a new edition of the Daily Debate. I'm your host for tonight, Muhammad Abdurrahim. The 100 Million Healthy Lives Initiative for the treatment and early detection of people with hepatitis C virus, HCV, and non-communicable diseases, NCDs, is considered a turning point in Egypt's healthcare system. The healthcare sector in Egypt has witnessed a remarkable development along the past few years, both in terms of the volume of investments made by the state or the initiatives that have been launched, and the state has succeeded in establishing and developing many hospitals and clinics as well in various governorates across the republic, which improve the health of the Egyptian citizen. The initiatives of 100 Million Health cover the many areas, including early detection and treatment of hearing impairment and loss, prevention of waiting lists and surgeries, early detection of virus C, maternal and fetal health care, early detection of anemia, obesity and stunting, early detection of genetic diseases, amongst other issues. We'll be talking about this great initiative and the achievements of this great initiatives, and also how to stay safe, how to keep your heart safe, how to prevent hypertension and diabetes, and the new medication that exists in today's world. And we'll be doing that in the company of our dear distinguished guest with us here in the studio, Dr. Ihab Daoud, consultant of cardiology. A very good evening to you, Dr. Daoud. Thank you for joining our program. Allow me and allow us, please, dear viewers, first to watch a report about our main topic for tonight, as we always do here in the Daily Debate, and then we'll come back and start our discussion with Dr. Daoud. Please stay with us.
The Ministry of Health and Population announced the launch of the first version of the electronic application for the 100 Million Health Initiatives as part of the New Beginning for Human Development Initiative. The application aims to facilitate providing citizens with services of the President initiatives for public health, as well as effective communication with citizens at all times and sharing health information. The application includes public health initiative services, which include women's health, screening, the treatment of chronic diseases and kidney disease, early detection of cancerous tumors, early detection of hearing impairment and loss in newborns, early detection of genetic diseases in newborns, detection and treatment of malnutrition, anemia and dwarfism among school students, maternal and fetal health care, examination of those about to get married, support for mental health and early treatment of autism spectrum disorders. The application also provides a registration service to receive a number of initiative services and direct beneficiaries to the nearest appropriate place to receive examination and treatment services. The initiative was classified according to gender and age, as the initiative included services for all age groups, and guidelines and information were provided for each initiative and the target groups to raise awareness of the importance of adopting a healthy lifestyle, which is reflected in improving public health indicators and achieving the strategic goal in the axis of building the Egyptian person and enhancing his well-being by providing a distinguished health service and activating the digital transformation in the field of healthcare. The launch of the first version of the electronic application for smartphones seeks to facilitate services for citizens and those targeted by all public health initiatives by providing the necessary information on how to obtain the service and where to provide it, noting that the application allows receiving all inquiries and suggestions from users to improve the quality of services provided. It is worth noting that the application is available through two links, one for Android phones and Apple phone.
Thank you very much, Manal El-Ibyari, for this report, and thank you, dear viewers, for staying with us. We're back here live with Dr. Ihab Daoud, consultant of cardiology. Dr. Daoud, I want to start by this new app that the government has installed for the 100 million healthy lives presidential initiative. How do you see the importance of this step, and how do you see the overall success of the 100 million healthy lives initiative?
Well, first, thank you very much for this honor being with you in this program. I would love to throw some light on what's happening actually by the government. At the current time, we have too many diseases, and we need too many drugs and procedures to be done. In the private sector, that would be very costly to patients. And actually what had been accomplished by the government is that they provide all the means to make life easier and reach the proper diagnosis and treatment in the public hospitals, at which cost at almost no cost. So if you're insured, like for instance, you go to the National Health Insurance or the National Heart Institute or whatever university hospitals, any patient can get all medications which are really very expensive. For instance, we have one of the most expensive drugs for heart failure, which is sacubitril valsartan. This is the ingredient name. This is not the trade name.
Okay.
It costs more than 1,500 monthly. You can get it there as a patient for £100 per month. You can see how the work is done.
The subsidy given to citizens in this
Let me add something else. If a patient has got like what we call the clogging of the coronary arteries, the myocardial infarction, like a heart attack, which we call it arbitrary and heart attack. Such a patient needs to do stent. Stent is to put this stent, open the vessel, and the circulation would be regained to the heart, and the patient will live. If you do it in the private sector, that would cost a lot at this time. But if you go to like any public hospital, you do it completely free of charge. So that's the program which has been termed Stent for Life.
Right. Amongst the important points regarding the initiative is trying to eliminate the waiting lists. So in that specific case, will the patient automatically find a bed and a doctor and
That's a very good point to arouse. Well, a waiting list has been there for 3 to 6 months in the chronic cases, but in the acute cases, there is no waiting list at all, no queue.
Okay.
You just step in, receive the medication, receive all the FDA-approved stents in the government. And the waiting list is not any further present.
Very good. Very good. Amongst, of course, the goals of the initiative, we mentioned some of them at the outset of the program. Others include support for women's health, screening for those who are about to get married, screening and treatment of chronic diseases, and early detection of liver cancer. The early detection, how important is it in today's world of medicine, early detection?
It's another good point. Early detection by screening of those patients whom we assume they are at risk. For instance, let me give you an example. If some patient who has a family history of diabetes or heart failure or hypertension or coronary artery disease affection, I would screen this patient as early as 40 or less than 40. I start screening. I'll do lipids, cholesterol I mean, then I measure the blood pressure, and if I see any of these figures are coming abnormal, I will suspect that patient and I will go further treatment and making further procedure for diagnosis of whatever the problem. So screening is good, that we can prevent the disease from progressing, or even we can prevent the disease from happening just from the start.
I'll get to that point, but before that, how important is AI or artificial intelligence in early detection, and how are we faring in this field in Egypt, AI in medical uses?
Well, AI is coming by any means. It will be the rationale in programming the detection, the screening, and further to some points in treatment plan, which is the management of such patients. We have started the AI, and I believe in just few years, AI will dominate and will take over the best treatment or management plans.
Okay, Dr. Daoud, now I think this is the thing that most of our viewers would want to be listening to, how to stay safe, how to keep our heart in the best condition. I want you please to differentiate between elderly, youth, middle generations, if I can say so, men and women. I'm sure it's
yes.
like there must be differences between
Yes.
Each and every category.
Yes, well, in medicine, what is the most important risk factor for diseases? It's age. So, it's when we are above 75, that's how they put it. But I'm treating so many patients, 80s and almost 90s, and they're doing very fine. So age is the first thing. And the young generations have their problems, whether inherited or acquired. If you don't take care of your health when you're young, you are going to pay the bill at a certain point. So better take care, better prevent diseases. So how can we do that? Number one, we have to stop smoking. There should be a campaign for smoking cessation. That's the most important thing, because smoking takes from the lives of people. This is not my opinion. This is not a belief. This is true. All right. Number two, we have to take care of a few other things. Obesity. There is the so-called body mass, BMI, body mass index. We have to follow this BMI. We have to see the waist circumference. It should be less than 94 in men and less than 80 centimeters in women. And the BMI should be in the normal figure, which is from 20 to 25. How could we measure this BMI? It's a kilogram over the square of the meter square of the height. So if someone is 2 meters, that's 4. If 100 kilograms, so we
25.
divide 100, that's 25 is the normal. Okay? We don't have to come high up than 25 to 30, that's an obese. More than this is 25 to this, it's an overweight, and more than this is obese, and you have the morbidly obese. What's morbidly obese is that obesity has done too many problems to your health, right? So that's obesity. It raises the blood pressure, predisposes to diabetes, problems with the musculoskeletal system, dyslipidemia, that's the abnormal blood cholesterol. So we have smoking, we have obesity, we have sedentary life. We have to encourage walking, leave your car, walk, it adds to your health. We have blood pressure, high blood pressure. We don't have to eat abnormal food containing too much salt. Something else which is very important, the sweet beverages. We have to stop eating sugars, white sugars, and sweetened beverages. They are very, very risky to the patient, and as well those what they call the supplements. These are going everywhere. Someone wants to make some bodybuilding, taking supplement and pills and
so you're against
and
that.
So on. Yes, yes. You don't know what's in this supplement.
But that's different from vitamins.
Vitamins, we have to take vitamins which are medicine, not vitamins which are over the counter. There's a big difference. Let me tell you, that's a very important point, because everyone is taking the vitamin tabs from whatever the stores in the United States and all over the world. These vitamins, the gelatin capsule which encloses the ingredient, may be really problematic and may contain abnormal ingredients that raise the bad cholesterol, the LDL. But if you take this vitamin from a medicine point of view, which is medicated, that's the proper thing to be taken.
Okay. So, Dr. Daoud, you mentioned some very important tips on how to stay healthy. I want to stay with some of them. Obesity, for instance. What causes obesity is usually fast food and eating in an unhealthy manner and eating before you sleep and stuff like that. What is the main reason for obesity, and how can we stay away from it?
Well, that's the most important thing. The fast food, sedentary life, you're not going to exercise at all, eating too much salt. We have only to take 2 grams of salt. Salt. Could you imagine that? That's the most important, which is like a spoonful. That's no more. So, and the most recent advances is that we take salt with not only sodium chloride, which is the salt, with potassium. 75% of the salt should be sodium chloride, 25 should be potassium, and it has been found that this potassium puts down the blood pressure and helps in that. Well, obesity as well should be treated. So you have to go on diet, you have to stop these sweet beverages. If not, there are the new group of medications. These medications are, actually they are medications for diabetes, but they are given and approved by the FDA for weight reduction, even starting from 12 years old.
Really?
Yes, and there's the, I'll just say, I mentioned the ingredient, the chemical name.
Yeah.
This called liraglutide, which is approved for obesity in children, 12 years. And of course could be given to the elderly. It helps in like 5 to 7% weight reduction of the body. There is the more advanced, which is the Ozempic. This adds 7 to 15% benefit to the patient. It reduces the weight by 7 to 15%. And now, which is the tirzepatide, which is everywhere in the world, it gives almost a 20% reduction in body weight. These are all injectable form.
Okay.
They are just taken once a week.
Okay.
And that's an advantage.
Dr. Daoud, I was just listening recently to a report about obesity in the United States. And it seems like the U.S. is one of the leading, if not the leading country in the world when it comes to obesity, something like 40% at the moment. That was stunning, the report I watched, and it was more in women than in men. I want to ask you about our situation here in Egypt, and in our food. I mean, each country would have its dishes. So what should we eat and what should we not eat so as not to have the risk of reaching obesity?
Well, almost the same percentage. We have women as well. They are the leading obese in the community. In addition, the youngsters in the States and as well in Egypt.
That's too bad.
Yes, that's too bad. They have extremely overweight, and many of them are really obese with morbid obesity. What morbid obesity? Morbid obesity is that obesity has caused problems in the heart, like hypertrophy of some of the chambers of the heart, and hypertension has caused diabetes, has caused problems in the eye because it raises the blood pressure, it raises the cholesterol. It's a combination.
And that's mainly due to fast food and the lack of practicing sports? I mean, that's... And
sugars.
Yeah.
And if you cut sugars, you can reduce your weight in 1 month. And I have too many people, I have so many patients, they have reduced their weight by just cutting carbs and sugar. And they have proved a really good work with reduction of their weight, almost 20%. That's an advantage to reduce these things.
What about hypertension? I mean, is it simply genetic? I mean, it's in the genes, or is it in the genes plus your lifestyle? And what should we do to avoid hypertension if we can, or treat it once we get it?
Well, hypertension per se, we have 2 categories of hypertension. The primary hypertension, we used to say it's almost 95%, which is you're going to get it at a certain point of age. And then secondary hypertension is that we have causes for this hypertension, and we used to give it a 5%. But in the last edition of the guidelines in Europe, they have put the secondary hypertension, this means we have causes, it's 10 to 15%.
Instead of 5.
Instead of 5. What could be that? There could be some problems with the glands, with the thyroid gland in the neck, with the gland above the kidney, we call it aldosteronism, primary aldosteronism and adenoma. It's like a gland which produces aldosterone. We have like something as well related to the kidney, pheochromo. We have problems with kidney troubles, chronic kidney disease. This also raises the blood pressure. So if we can treat these things, we might alleviate these symptoms. We might get out of this circle. But we have primary causes. This means this patient is going to have hypertension at a certain point of age. So we have to see who is going to have this. How we do that? Once you're 40, and you don't have the risks of the family, you should be screened every 3 years. If you get a hypertension, then you're going to treat at a certain level of blood pressure. What about less than 40?
I think I'm personally the classic case, because I discovered it in 2011 when I was 40, when it was exactly 40. That's the year I remember very well, that I knew I have hypertension and I'm going to take hypertension medicines for the rest of my life. 2011. I was exactly 40.
Maybe you were eating junk food at that time. Probably. Junk food, of course, contains the bad cholesterol as well. But the figures were really different than this last August. They used to say if you're 140 over 90, then start treatment. Now they have put down the figures of blood pressure. It's 130 over 80 if there are other risk factors. What does this mean? If I see a patient with 130...
Well, what if somebody's default is 140 over 90? I mean, that's the default.
There is no...
That's the borderline, or is that too high?
No.
140 over 90.
140 over 90 is not acceptable at all, because it injures the blood vessels. The hypertension, like for instance, you're pushing some air or pushing some water under pressure in a hollow vessel. It injures the vessel from inside. So it injures the vessels of the brain, of the carotid.
So this number is unacceptable. It cannot be the norm.
No, this is not. So you must, the one with hypertension, 140, must receive anti-hypertensive treatment plus other risk factor adjustment. For instance, diabetes, for instance, cholesterol, must get the cholesterol to normal. If 130 over 80, but with problems in the heart or in the limbs, or had earlier problems in the circulation, or diabetes or lipids, must receive treatment from 130 over 80 and to get below this figure. But for the elderly, if you're 85 or more, and we have in the community now 80s, we're seeing very commonly, we can give a lenient, some more acceptable blood pressure. We can stay 140 over 90 in the very elderly, 85 plus.
Okay. What about low blood pressure? How dangerous is it or not? I don't know.
Well, we have something in the tissues, like in the brain, like in the heart. If your blood pressure comes below 100, sometimes people may get dizzy, cannot do some effort, may feel short of breath. This short of breath actually from the low blood pressure. At this instance, we don't give too many drugs that cause constriction of the vessels to raise the blood pressure. Just a little of salt, much water, that would help a lot. But don't give any medications that would cause vasoconstriction. Otherwise, this patient would turn in the near future into a hypertensive patient instead of being hypotensive.
Okay, very interesting. Dr. Daoud, dear viewers, allow us to watch another report about our main topic for tonight, and then we'll come back and continue our discussion. Please.
Egypt has become the first country to achieve the gold tier status on the path to elimination of hepatitis C as per World Health Organization criteria. This means that Egypt has fulfilled World Health Organization's programmatic coverage targets that will set the country up to achieve their reduced incidence and mortality targets of full elimination before 2030. Egypt's journey from having one of the world's highest rates of hepatitis C infection to being on the path to elimination in less than 10 years is nothing short of astounding. Egypt is an example to the world of what can be achieved with modern tools and political commitment at the highest level to use those tools to prevent infections and save lives. Egypt's success must give hope and motivation to eliminate hepatitis C everywhere. World Health Organization notes with appreciation the ongoing commitment of the Ministry of Health and Population to sustain robust screening, care and treatment services for people with HCV. Since Egypt launched the 100 million health campaign, it has resulted in testing over 60 million people and treating more than 4 million. And by doing so, Egypt reduced the incidence of new infections from 300 per million in 2014 to 9 per 100,000 in 2022. This is very close to the ultimate goal of hepatitis C elimination of less than 5 per 100,000 new cases per year and similar levels for viral hepatitis deaths. Egypt became an inspiration to many other countries who are working toward the elimination of hepatitis C, hepatitis B, or mother-to-child transmission of hepatitis B. Similar achievements are within reach of many countries if they follow Egypt's example. World Health Organization released its second and updated version of the guidance for country validation of viral hepatitis elimination and path to elimination. Through the validation process, World Health Organization and partners continue to provide country support for strengthening health system capacity and patient-centered service that respect people living with viral hepatitis and ensures meaningful engagement of communities in the national, regional and global viral hepatitis response.
Thank you, Manal, again for this report. We're back here with consultant of cardiology, Dr. Ihab Daoud. Dr. Daoud, heart failures recently are not just hitting the elderly, but sometimes the youth, and sometimes even those who practice sport while they are practicing the sport, and this is confusing to many of us. Can you explain to us this phenomenon?
Well, this is a phenomenon, but it's been there since a long time, but there hasn't been enough light shed on. If you play sports, like for instance in Italy, they go on screening these patients, these sport players, since a long time, but when they're 13, because this is the exercise age where you do vigorous exercise. They do an echo, they do an ECG, they do an X-ray. And then they do some blood tests. This is the only passport to do vigorous sports. I guess we have started this in Wadi Nil Hospital in conjunction with an English football club.
Okay.
And this has been now attempted here in Egypt. Because some patients have congenital heart disease. They are born with a problem in the heart, in the ventricle. The ventricle is the most important chamber, the left side, which pushes the blood outside the heart to deliver the blood to the whole body. They have, like we say, left ventricle hypertrophy, a disease called hypertrophic cardiomyopathy. We have problems with the conduction of electrolytes, which start the contraction of the heart, because contraction of the heart is a function of a battery inside the heart. We are born with the battery inside the heart, like the battery in the car, in the hood of the car. Exactly, with branches, yes. And it has bundles, like exactly in the car, supplies the chambers. Some of those who succumbed had a problem in these conduction of the electricity and the channels which conduct the electrolytes, the sodium, potassium, etc., etc. So these are congenital who experience, we call it sudden cardiac death. Many of them get resuscitated when we have the DC shock everywhere, like in the West, and I guess we are going to do that. You mentioned heart failure. Well, heart failure is, of course, is a 2% of the population of any community. This is a big figure, and we have to prevent heart failure. Now, there are a few medications, like the gliflozins, the dapagliflozin, this is the
chemical name,
the dapagliflozin, the empagliflozin. These prevent heart failure. They are really originally diabetic medications, all right? So they have an impact on preventing heart failure and preventing hospitalizations and death from heart diseases.
Wow.
Another
And this is given to elderly and youngsters alike?
Yes.
If needed?
If needed. And they as well are medications that treat diabetes and cause weight reduction.
But they must be very expensive, I guess.
Actually, the generics in Egypt have made them at no cost. They are here, they are present, and the government supplies them as well. Plus the very expensive medication which we have said, just mentioned the name, which is sacubitril valsartan, which is present and the government supplies it for £100 per month, which costs more than 1,500 monthly. Plus, any subject who feels chest pain, I would say do not stay at home. Conduct your doctor. If not available at that time, just visit the near emergency department in whatever hospital. They take good care. Because don't wait until the coronaries, the heart vessel, which supplies the blood to the muscles of the heart, get clogged.
But how can we differentiate between chest pain that could be a lead up to a cardiac arrest or chest pain that simply has to do with a flu or cold?
We have many ways, but of course this could not be done at home. So first of all, we do an ECG. So sometimes we do an echo immediately. It may prove. And the most important, we do a laboratory test which is called the enzymes of the heart. So this could be done in the hospital, and the results of the enzyme of the heart come out in 20 to 30 minutes, so that there is enough time to take the patient to the cath lab, for instance, to put a stent. And the golden hour is the first hour from the onset of chest pain. If you put a stent at that time, you've saved the heart, you've saved the life of the patient in the first hour.
I wonder, those who have put stents, would they be healthier than those who haven't? I mean, I'm just wondering.
Those who haven't, if they have problems, obstructions in their coronaries, of course, they don't know they are at risk. But those who have put stents, I always say this word, who have had a stent is really lucky. Because this subject, this guy or this woman, this one has treated his condition. But others, they don't know. They don't know what
they have a condition or not.
If we have or not. So, any chest pain, any shortness of breath unexplained, please visit your doctor. This doctor will go stepwise. This is stepwise, ECG, echo, and then if we are still missed, we can do something called the stress test. We can do something we call perfusion imaging. We call it thallium. We can go further to what we call multi-slice coronary angio. This draws the coronaries, the coronary vessels of your heart, and we can see them in color on paper, and we can see if there is an obstruction or not. And later we can take such a patient, if that patient would deserve, to the cath lab, put one stent, put two, whatever. There is no harm to put one or more stents. Plus the medications for the thrombosis. So when we put a stent, there are many medications, the new ones, which prevent this stent to get blocked again within the procedure, after the procedure, and later in life.
Would that medication be for life, or would it?
This medication, we start by 2 medications for the first year. After the first year, we omit one of them and we stay on the other for life.
Okay.
That's what we really do.
Okay. As we wrap up, Dr. Daoud, what are the challenges facing the Egyptian healthcare system at the moment? What is it? I know it's a big topic, but I mean, in the couple of minutes that we have, what is it that you want to see happen in our healthcare system to get it to an even better status?
Well, I would conclude that number 1 is to stop smoking. Don't smoke. Don't stay within the second-hand smoke. You can be a passive smoker. You get the same risks as those who smoke. Try to reduce your weight to the ideal weight. Eat well. Eat what we call the healthy diet, which is the DASH diet, because this is the Mediterranean diet, fruits, vegetables. Get away from the the oils which are burned because they are risky. Less food. Don't eat every time you feel in your stomach. Do exercise. Don't stay in your car. Try to walk, try to move. They have found that if you do 150 minutes per week of moderate exercise, like walking or climbing stairs, or 75 minutes or more of vigorous exercise with weightlifting, you can protect yourself from heart attacks and from problems in the coronary arteries. The coronary arteries, I would love to say something, the coronaries, they have termed them the coronaries because like a corona, like the corona which the king wears, around the heart when the heart is visualized.
Okay, so this is what we have to do. What do you want to see from the government?
At that time, medications are there. The screening is there. We just need to spread the national health insurance to cover the 100 million or 110 million Egyptians. If that would happen, I believe the mortality would decrease and the morbidity. Mortality is one, of course, someone dies. Morbidity is that when a patient gets like a stroke in the brain, like an infarction in the heart, and moreover problems with the limbs if diabetes is not controlled.
Egyptian doctors are very talented. Do we have enough doctors, or do we still need much more?
We have too many of our doctors who migrated.
Yeah, I was going to ask you about that.
That's not a good point.
But those who migrate really excel.
They are very good. From the hospital in which I work, I have 3 of them. 2 went to the UK, and 1 has been going to the Saudi Kingdom of Saudi Arabia. And we need more doctors, and we need them to stay in Egypt.
Okay, so we still need
yes, how to encourage doctors to stay and not to leave.
Yes, very important. Dr. Ihab Daoud, consultant of cardiology, it's been a great pleasure. Thank you very much.
My pleasure.
And thank you, dear viewers, for watching the Daily Debate. Good night.